G'day, I'm Dr Marcel Kalau, and thanks for trusting me with your vasectomy. I've done over 6,000 procedures, so you're in experienced and safe hands. This 6-minute video contains some really important information that I'd like you to watch before the procedure and filling out your consent form. I'll walk you through the options, how to prepare, what to expect, and some of the key risks. Don't worry, there aren't any graphic images, there's just a cartoon image on the first slide. But if you want to see some more cartoon images of the procedure, you can find them on my website.
A vasectomy is a permanent form of contraception. It works by dividing the vas deferens, the tubes that carry sperm, from the testicles. After the procedure, you'll still produce semen as normal, but once cleared, it won't contain sperm. It's important to understand that vasectomy should be considered permanent. Reversal and IVF are possible, but are expensive and not guaranteed. Before going ahead, it's important you're aware of alternatives. These include condoms, or your partner could consider the oral contraceptive pill, or long-acting hormones or non-hormonal intrauterine devices. Vasectomy is one of the most effective options, however, with over 99.9% success, but it's your decision and it should be considered carefully. To prepare for your procedure, please complete the online registration and consent form after watching this video. Let me know if you're taking blood thinning medication, as you'll probably need to stop these a few days beforehand. Eat and drink normally, no fasting is required. Stay well hydrated and wear supportive underwear on the day. Please shave your scrotum and base of your penis using this diagram as a guide. It's also on my website. Don't shave your upper pubic area, as you'll probably get ingrown hairs and itchiness if you do, and that area is covered anyway. The easiest way to shave is by using a razor and shaving foam in the shower. Electric clippers are more likely to nick the skin, and creams can burn. I'll make you feel as comfortable as possible from the moment you arrive, and you'll be given time to ask questions. Your partner is welcome to attend the consult, but I then kindly ask them to wait outside during the procedure so that my focus can be on you. Before we start, I'll do a quick examination just to confirm that it's possible and safe to proceed. About 1 in 50 men have really retractile testicles, and it's safer for them to see a urologist and have a vasectomy done under general anaesthetic. The procedure itself only takes around 15 minutes. You'll be covered with a sterile drape, so only your scrotum is exposed. I understand it's a private area. It's done under local anaesthetic, so you'll be awake, but most men find it much better than expected, and I'll talk you through everything as we go. After numbing the area, I access the vas deferens through a small opening in the skin. I use the most up-to-date no-scalpel technique. I then divide the vas deferens and seal only the upper end of it using a hyfricator and a dissolvable stitch. The lower end is left open so that sperm can be released inside the scrotum rather than being trapped in the testicle. Sperm cells are really minute and only form about 1% of your ejaculate, and are naturally reabsorbed once released. These steps are done both on the left and right sides. You may feel some pressure or minor discomfort, but it shouldn't be painful. If you're uncomfortable at any point, just let me know. There are no stitches on the skin afterwards, as it heals naturally in about 5 days. After your procedure, it's normal to have some mild discomfort, and mild swelling and bruising are also common. I recommend using an ice pack, simple pain relief, and resting. There are also some restrictions around strenuous activity and sport. I'll give you a handout on the day with clear instructions, and it's also on my website. I'm happy to provide a medical certificate for time off work or light duties. It's very important to understand that vasectomy is not immediately effective. You must continue using contraception until your semen test confirms clearance. This is done at least 12 weeks after the procedure, and you should assume that you are still fertile until I contact you with your clearance result. Vasectomy is very safe, and the vast majority of men recover without any complications. However, all medical procedures carry some risk, and it's important to understand these before consenting to the procedure. About 1 in 100 men might feel lightheaded or even faint briefly during the procedure. We'll look after you if this happens. Please inform me if you have a history of fainting, and eat and drink normally beforehand. The risk of infection is very low, about 1 in 100, but please let me know if you're getting increasing redness or discharge from the wound, or fevers, severe pain, redness, swelling, or heat over your scrotum. Infection is usually just treated with tablet antibiotics, which I can provide, but I very rarely need to do this. The risk of bleeding during or after the procedure is also very low, and some men are more prone to bleeding than others. Around 1 in 100 men might develop a collection of blood inside the scrotum called a hematoma. This usually self-resolves but can be uncomfortable in the process. You can decrease the risk of bleeding after the procedure by taking it easy and following the instructions. The risk of the vas deferens rejoining is extremely low, both in the short term and in the longer term. The risk is higher in the first 12 weeks, which is why it's important to do your semen analysis. A granuloma is a small lump of scar tissue which may form near the end of the vas deferens. This is usually minor and often settles over time or with anti-inflammatories. A very small percentage of men experience aching or pressure from sperm buildup after the procedure. This is usually temporary and also often improves with anti-inflammatory medication. The open-ended technique which I perform greatly reduces this risk. Pain which persists for more than 3 months, also known as post-vasectomy pain syndrome, is extremely rare. It may affect 1 in 1,000 to 1 in 2,000 men, and most of the time it doesn't have a significant impact on day-to-day activities. The pain is often manageable with medication, but rarely further treatment or surgery is needed. Please make sure you understand this video, and also be reassured that I'm very experienced, and if you have any concerns after your procedure, please get in touch. I'm always happy to help. Thanks for taking the time to watch this, and I look forward to seeing you on the day.